So, hello, I'm Jonghyun Park of the Duri Clinic. Today I'm going to talk about treatment planning of the edentulous maxillar. So, in case of the edentulous maxillar, for restoration, there could be 4 cases. First case is where you can use fixed prosthesis, so you have sufficient bone as well as lip support. Second case could be where you have enough bones, but there's a lack of lip support due to a lot of tissue loss. Third case with lip support is sufficient, but residual bone is not sufficient. Fourth and last case will be the bone is insufficient as well as the lip support. So for 4 cases, let's take a look at them one by one. So there are things to consider for maxillary edentulous restoration. There are many things to be considered. First is, whether the bone sufficient, aesthetic evaluation, distance and relationship, patient needs, economic requirements, and also requirements for opposing teeth. So a lot of things to be considered. Compared to mandibular, maxillar side, placing implant, if it's edentulous case, there is a lot of challenges. So first is when there's enough residual bone and also enough lip support. So it's an indication for fixed prosthesis. So in this case, fixed prosthesis needs to be used. If you use removables, then there could be different problems. One of the biggest problem would be that patient after restoration, they say their mouth is protruding. So there's not much of the alveolar bone resorption, and if you use dentures, of course, this can be the problem. The alveolar bone resorption is minimal, and if you use removable, and there is excessive resupport. So in insufficient space, if you do overdention, not only have excessive resupport, then fracture and other problems can arise. So alveolar bone resorption is minimal, and if there's economic viability, then fixed prosthesis will be the best option. So there's not much of bone resorption, and residual bone is sufficient. Then it's a fixed prosthesis indication. In such case, if you use overdenture as a compromise, then you could have a lot of problems on your hands. After implant placement, abutment was connected, and I did immediate loading. Aesthetic and functional problems were fixed in very short time. After 3 months, in conventional way, fixed prosthesis was delivered as the final prosthesis. So this is something you always think about. If you do restoration with fixed prosthesis, how many implants do you need to place where? So if this is V-shaped, then to reduce cantilever, I put arrow there. On the central incisor, it's favorable to put one more additional abutment implant there. It's more favorable the right side. If it's U-shaped, then on the anterior side, restoration with 2 implants could be an option. But like this, if to reduce cantilever volume, then in central incisor, adding 1 more implant would be more favorable. So if you do only up to first molar like this, total 7 can be placed for final prosthesis. Using guide, 7 implants were placed, and in 3 segments, final prosthesis were completed. So this is panorama picture. So like this, if you do in second molar, then 9 to 7 implants can be placed in 3 segments. That would be my favorable approach. Using guide, 9 fixtures were placed, and I did immediate loading. 3 segments, final prosthesis like this were completed. So final panorama picture. Now, on the maxillar side, smile line is very important. If it does not impact smile line, then to have more oral hygiene conditions, I use supragingival margin up to where you can see in the smile line. Of course, I try not to show any metal, but there's no impact on the smile line if that's that area, and even the anterior maxillar side, using supragingival margin, I create the final prosthesis. That is my preferred way. If oral hygiene can be well maintained, hence even after 6 years, it's very cleanly maintained. So this considered, so I used class RPD, and that could be one option. On the both sides, 2 implants were placed. And RPD is covered by health insurance, and up to 2 implants is also covered by health insurance. Hence, you can do very attractive restorations. Cost-wise, functional-wise, you can maintain a lot of good, successful results with this type of restoration. Next is where there's enough residual bone but insufficient lip support. So these are very tricky situation. Now, removable prosthesis to have favorable, facial form, it might be helpful. If there's not sufficient lip support, if you have such thick denture flange, it can help give you more favorable facial form. Preserved lip support versus lost lip support needs to be considered in choosing the right option, and this is very important area. So pay attention, please. So smile line, of course, is also another important consideration. If it's indental maxillar, the prosthesis cannot be chosen based on the patient requirement. That's what Lagos said, and something that gives you a lot of takeaways. So vertical space, if it's too excessive, then and use fixed prosthesis, then oral hygiene management might be very difficult. So as I showed you in another lecture, it was done 3 years ago in another dentist. So filling all lost vertical space with fixed prosthesis, then oral hygiene management will be very difficult. So how do I restore in this case? I'm going to talk about that a bit later. If it's insufficient lip support, then removable prosthesis can be of help. So at least on the maxillar side, what this figure means, I think you will understand whether to go with overdenture, fixed hybrid denture, or fixed bridge, depending only based on patient requirement is not the way to go. So on the upper and lower side, the vertical dimension could be misinterpreted due to the horizontal relationship. You will understand more by looking at the vertical dimension has been reduced. In first glance, the lip support looks insufficient, but if you bite with a cotton on and you can have a slight recovery of vertical dimension, then you see there is actually with support. So fixed prosthesis might be a probable option. This support is not a bit lacking, but as a compromise, I did with this prosthesis, and it's after 2 years panorama photo. So again, let me give you a summary. Now, vertical dimension, if there's a loss, there are many patients like that, then in such case, you have to see whether there's sufficient lip support, and you should see also the relationship inside, and you have to have an accurate understanding of that. If there's insufficient lip support, I prefer hygienic type the best. This is not my case, but this is from the Wonju University. Insufficient lip support was restored with hygienic type. So with ceramic metal, it was restored, and oral hygiene, with this can be managed better. If it's impacting smile line, then of course lost tissue area can be treated with pink porcelain, but if there's no impact on smile line, then all leaving as empty space could be, in terms of oral hygiene maintenance, be better. And also, like DINS, if there's a lot of tissue loss and oral hygiene can be tricky, then pontic base shape is very important. If it's concave shape, then could be a lot of plaque accumulating there, like this. So you have to remember this picture very well. If it's not concave, convex shape is better for plaque not being accumulated, and if possible like this, but 2 mm space needs to be given. That would give you more favorable results. So can you understand? If it's like convex pontic base, in terms of oral hygiene management, it's more favorable. And if it's concave shape, oral hygiene maintenance will be very unfavorable. So you have to avoid that. If it becomes concave, then plaque will accumulate and cannot escape. Hybrid type, if you use that prosthesis, then convex pontic design, a wide embrasure space is two things you have to remember. It's very important, 2 points. So for me, if insufficient rib support, then fixed prosthesis. If the patient wants that, then the hybrid type, because it's oral hygiene maintenance worse, then I use the hygienic type. Of course, it will impact smile line. Patient would not like that, so you have to be careful. So this one says a lot of different things. Smile line, if there's impact to that, then like this, doing prosthesis, and then telling patient, oh, this is a successful result, then patient would really complain. So in this case, as I already shown you, pink porcelain can be used, and it's better to make as a hygienic type. If there's no impact to smile line, then for oral hygiene management, hygienic type would give you favorable results, more favorable result. There is the bone, but there is a lot of recession to use this denture for a long time. After placing implant, I did immediate loading. Oral hygiene management for that, as much as possible, I created big embrasure, and I did use a supragingival margin and used hygienic type. So final prosthesis compared to removables, if you compare the two, you would know what I'm trying to say. Up to where smile line is seen, then as much as possible, I reduce margin to the gingiva side. But if its smile line is not shown, then that area like this, I create with supragingival margin and try to open space as much as possible. This is the way more favorable hygiene, oral hygiene management. Clean prosthesis, which I as dentist cannot clean very well, and telling patients to clean that well is not very good. You have to create prosthesis where patient can keep it clean, will give you more aesthetic result. So because of the invisible area like smile line, just to create aesthetic result in the area you cannot see, creating prosthesis that is oral hygiene wise difficult to maintain is not right, in my opinion. Next is there's sufficient rib support but insufficient bone. So you could, think about bone grafting. Lip support seems to be sufficient. And when you create temporary denture, there's excessive rib support. Then if you use removable here, the patient might complain about, protruding mouth. So this is initial visit panorama. Insufficient amount posterior bone can be clearly seen. So with the bone grafting, restoration was done with the fixed prosthesis. Smile line, if it's not impacting that, then even the posterior side for oral hygiene maintenance, finishing with supragingival margin is something I'm approaching different from other dentists. Where it's visible, I focus on aesthetics, but if it's invisible area like this, oral hygiene is my top priority consideration. So if there's not much of bone, therefore bone grafting cannot be done, then shortened dot technique is something I prefer. So, like this type of restoration is something I also consider. On the right side, there's no restoration, but patient could still chew. And after 5 years, panorama photo, stably, implant is still functioning. So if there's insufficient bone and insufficient rib support, what to do? Let's look at it. So you could think about bar over denture. I didn't have a good case, so I borrowed from another professor. So using the splint bar, you could, have a stable implant, and you could also have a better facial form. So it's a good option. So let me give you a summary. If you have enough residual bone as well as enough rib support, it's good indication for fixed prosthesis, but contraindication for overdenture. Overdenture being contraindication, if you understood even that one sentence, you have learned a lot through this lecture. In class 2, you could think about overdenture, and if patient wants fixed prosthesis, hygienic type is my favorite option because you can maintain oral hygiene better. And I hope you understand what the hygienic type is. It's important. In class 3, insufficient bone and sufficient lip support, you can do bone grafting or anterior implant and using RPD. On sufficient bone as well as insufficient lip support, then bar over denture is something you can consider. So this has been the lecture for restoration of the edentulous and maxillary functional restoration, but sometimes you also think about the better facial form, so it's a very challenging situation. Oral hygiene management is also very important. So these things all need to be considered in getting the treatment plan so that you could have a good, successful results. With that, I'd like to finish this lecture. Thank you very much.